My job when I see patients with hip pain is really to determine what is the origin of the pain. There are several different structures around the hip, and then areas that can cause referred pain to the hip area that can cloud sort of our diagnostic process. So sometimes I see patients with back issues or nerve issues where the pain radiates to the hip, and it's not truly a hip issue, it's really more of a back issue. Sometimes I see patients with more tendonitis type issues of the hip or overuse injuries of the hip. Sometimes I see patients with hip arthritis or problems within the hip or labral issues, so problems within the hip where the origin of the pain is within the hip. But again, my job, and this can sometimes be difficult in the hip, is determining what is the origin of the discomfort, because we want to have the best diagnosis so we can effectively treat you and get you back on your feet and doing the things you want to do.